Welcome back to one more session on lean in RCM. So today we are going to see one more denial and how we can control that or we can restrict that through the lean methodology. So this is what we started discussing, and we discussed about the timber, which is a very basic for the lean methodology: transport, inventory, motion, weighting, overproduction, overprocessing, and defects. So if you why we are every week we are discussing on the 7 points is if you understand the seven very clearly, then you can think how we can avoid these scenarios from the denial, what we are discussing. That's the main reason we are covering every week this particular 7 based methodology. And if you come back here, the denial, what is the denial, how we can control it, this is all we covered in detail. And this is our basics for our lean, right? Which is a pre-billing audit, or we'll call it as a billing audit, wherever the pre is not possible. So this is the basic one, which we can stop all our denials. So today also we're going to see the similar type of denial, which is the pre-billing audit play a major role, right? And we discuss about the PDCA, and I'll move to the today's session. And the denial which we are going to cover today is relevant to the front end problem, right? When the claim is getting denied, okay, how we can fix it from the front end. That's what we are going to cover today. See, our today discussion is about the claim denied for the benefit exhausted. Okay, that is our major challenge. How we are getting this benefit exhausted can be stopped, or how we are going to handle this benefit exhausted. See, whenever you get any benefit related problems, I added, as usual, I added the denial code in the Excel sheet. You can download it and then you can check it. See, now, whenever you have any benefit related problem, you have to go back to the patient benefit and you need to check, right? That is a key information on that particular benefit. See, now the question is, benefit can be done in a different ways. One, it is based on the dollar value. Okay, for example, the benefit can be for a dollar certain. Okay, this is for certain dollar. Patient can be treated only for $1,000 per year, or it will be a $1 lakh or $100,000 per year. Like that, they have a restriction. Say, actually, after this, lot of resolution and then revolution came in healthcare, the dollar value denials will not come now. Okay, unless it is very specific to the commercial plan, you will not get this dollar value denial. If anything like that, you first call the insurance, understand, is it the benefit is met or not met? Okay, if it is met, then patient is responsible for this and patient has to pay this. And usually dollar value, as I told you, it is not existing. If you get anything like that, then it may be the patient problem. They didn't change the benefit and they will be responsible for this. And when in the call itself, if you know that benefit is not met, send this claim back for reprocess. That's the only option what we have. And second one, if anything related to the procedure or service, you will find this frequently in this particular RCM, the denial metrics. See, for example, what happened, the CPT by the frequency of the payer, right? Usually the providers will give the metrics only for the few CPT code they can make you to get service. Say, for example, if the patient is enrolled with Medicare, right? In that scenario, within 12 months, okay, patient can take some treatment. If it is more than 12 months, okay, they cannot take that particular treatment. And the similar way, if any of the, for example, if the OBGYN patients, okay, radiology can be done, right? The scanning can be done only 2 times. It cannot be done more than that. Okay, each and every procedure based on the patient benefit plan, this is well defined. Say the CPT frequency by payer, and this may vary from time of enrollment and specialty wise it will vary. That's what I gave you the example of OBGYN and Medicare enrollment. Within 12 months, they have certain benefit. After that, it will exhaust. So first you have to understand what is the benefit and go to the PMS and filter by the CPT code and then check it. See, for example, as I told you, OBGYN only 2 times it's allowed, the radiology services. Check whether 2 times has been completed. If it is not completed, send this claim back for reprocess. If it is already met, the 3rd time, the insurance will not going to pay and the patient will be responsible. And this is doctor's responsibility. Whenever the patient is in need for a third time, they have to explain this is a non-covered service by their benefit plan, and the patient will be responsible for that. We have to explain that in detail to them. So this is the flow for the procedure and services, right? As we told you, whenever they enroll, each and every patient benefit plan will have its own criteria. We have to understand that. And the third one is related to the provider contract. See, what do you mean by provider contract? See, whenever the provider is signing a contract with any of the insurance, right, the insurance company will give very clearly, these are all the services will be covered from your services, and these are all the services will not be covered. See, for example, the doctor is a general doctor and he's trying to do a radiology service. Okay, so he's doing OBGYN scanning for a patient, which is not allowed for that particular provider contract. In that scenario, they will say that this will not be covered. And this need to go back to the medical policy. We need to check the medical policy of the particular insurance company. And if it is correct, then we have to adjust it. If it is incorrect, we have to send it back for reprocess. Here, the one challenge is here, it is all this particular denial is relevant to the benefit. It is not relevant to the coding. That we need to understand, right? Majority of the time, what is happening is we think that the benefit information is relevant to coding, but it will not be. See, for example, you're sending claim back for coding review, and the coders cannot fix this problem. They identify it is not my problem. Okay, how I can work on it? That's a way the coders will return back these claims to you saying that bill correctly. So you have to be very clear. Okay, what need to be sent to coders and what need not be. So this about your benefit information. So I'll go quickly. I'll combine. First one is dollar value. If dollar value is met, patient is responsible. Dollar value is not met, then you can send it back for reprocess. The same way, whenever the CPT or procedure, first go through the patient policy, insurance policy, how many time it is billed, what is the time frame it is allowed. You do that homework, and if it is met, you have to bill the patient. If it is not met, you have to send it back for reprocess. Provider contract, as per the contract, you have to visit the medical policy or a provider contract to understand this particular issue, how we can solve this. Okay, how we can do it differently by using the lean. That's what we are trying to cover, right? See, the lean methodology, what we are trying to do here is we will identify why I'm getting this particular problem. See, the benefit not met, right? Benefit already met. In this scenario, it is a front-end problem, right? When the claim or your client has a eligibility verification and your prior authorization team, okay, their main job is they have to check whether this benefit is covered or not covered. How they are checking the deductible met or not met. The same way the benefit is met or not met is a major thing which they need to identify and they have to fix it. And second one, whenever the patient benefit is met, create an alert in the summary so that the future claims will not get affected and your front-end team as well as your AR team will understand what is the patient benefit, how we are going to handle it. This is a very important one. If anything is continuously missing, you go back and then revisit your benefit verification plan. And the next one, say for example, this is a procedure-wise. Okay, usually some of the softwares, okay, if you take ECW or some other prominent software, I didn't remember what are the software, ECW, what I remember. See, for example, this particular code is allowed only for 3 times, especially for Medicare. This PMS will give alert to you. Even if you check the eligibility of a patient in Medicare websites, the website will tell you how many times this service already covered for this patient and how many services are left over for this patient benefit. These are all the details you can find in the benefit plan. And you have to make sure that this is getting populated as an alert message in the patient history. That is one. And second one, in the provider contract side, say whenever you have that provider contract is not allowed, see what you need to do, you have to create an edit and then stop billing for the non-payable services. So you can talk to the client and then inform them this is a waste of time, what we are doing, and then we are sending unnecessarily this claim, which is not going to be paid. So these are all the lean methodology. Lean methodology, that's mainly 2 points. One, the benefit information, benefit verification need to be improved and fix the problem there. And second one, create alert for the patient history. And third one, here, stop billing non-payable claim as per the provider contract. Okay, this will solve your problem related to your benefit information. Okay, yeah, this about this particular week denial, and we will connect again next week with one more denial.